Tonight on The Edge, trouble brewing at Corewell's Dearborn Hospital. Some patients are being discharged with nothing. No clothes, phone, money, or even shoes.
Dearborn police say it's happening far too often, and they're sounding the alarm. It's a story almost hard to believe.
I have no money or no means to get nowhere.
You're looking at a police body-worn camera, a patient just discharged from Corewell Health Hospital in Dearborn.
Last week we had one patient in clothing provided by the hospital, but it was the paper clothing.
He didn't have shoes on and was hooked up to a colostomy bag, wandering a neighborhood where the hospital is located when Dearborn police respond.
So where are you trying to get to? Southfield and 4th Street. I can take you there.
Fox 2 is learning this is not an isolated incident, according to police. This year alone, 200 calls for police service to Corewell Health in Dearborn.
Most of the calls that we're responding to are patients that have been discharged from the hospital without any means or modes of transportation. And oftentimes we're encountering these patients with hospital gowns.
Dearborn Police Corporal Dan Bartok says they've been in talks with higher-ups at Corewell Health to figure out a solution because their officers are turning into a taxi service.
We're having to respond to those numerous calls for service, oftentimes tying up multiple police officers to solve these problems.
Corporal Bartok says in those talks with Corewell Health, they've said it's their policy only to assist patients with transportation 2 hours or later after they've been discharged, not before. Anxious patients end up leaving before. The hospital released a statement to us that says safety is our top priority. During the discharge process, we ask patients if they have transportation. If they do not, we offer assistance. Sometimes patients do not accept our assistance. Due to patient confidentiality, we cannot discuss specific patient situations.
We continue to work with Corewell Hospital. We're encouraged that they're going to come to the table and help resolve these issues.
So we reported this earlier at 10 as well, and my social media has been really blowing up
yeah.
with people sending videos of patients coming in their backyard in the neighborhood. And you know, we're going to vet some of these things, but this is definitely not an isolated situation, and it is coming from police. We hope that there can be some resolve here, but they definitely want to get it out to folks, maybe put a little pressure on the hospital system.
Yeah, and I understand there's some 200 calls for service this year, and these are patients who are just kind of leaving against medical advice. And that's one thing to keep in mind, that sometimes they're being told, no, you can't leave, but they leave anyways.
Yeah,
right?
but most of those calls, they are actually discharged. That's the word that's being used. But we'll continue to follow this. This isn't over.